This video is the product of the Functional Cranial Release Research Institute. For difficult neurologic conditions that no one seems to have answers for, visit functionalcranialrelease.com.
So, functional cranial technique is a fantastic technique. It's one that is, I don't think as well known as many techniques are in our industry, and it should be. It very much should be. As far as the technique itself, it's not extremely complicated, although a bit odd for some patients to initially experience, but because it's dealing with the central nervous system directly, it has a profound impact on a number of different disorders. So most of us have come down here to look at how Dr. John has put together an approach for evaluating the system as to what has gone awry or imbalanced in the nervous system to drive balance back.
Okay. And so where are you from?
I'm currently in the DC area.
Here.
Yeah, I'd say that's invaluable. I had learned the technique in a more kind of hands-on capacity in a different setting, and it was something that I was comfortable running with after that point. But most people aren't going to be. As you'd mentioned, a lot of even your students, in the past, that has been something you worked to make sure was involved in your program, that there was a level of comfort in just the basics of the protocol and the application of it. So I think that you worked that into the program very well. Had I had no experience, I think I'd leave feeling comfortable doing so, which is a very big piece, I think, for any practitioner with any new technique, right? Mm-hmm. I mean, you can go get a lot of data somewhere, but being able to walk back in and go, yeah, I'm gonna play with this, that's a different go. So the time off for that, everybody thinks of that time, either clinic, time, lost with patients, then the expenses coming. And I think most people looking at this program wrestle with that for a bit of time. So if they're looking at the testimonials, it's a profound technique that it is very useful to take that time to apply. Certainly if you have no experience, it's necessary to have that follow-up with these patients and have that feel in their system, learn that anatomy, and be able to feel pretty proficient with it leaving. So, yeah, I mean, that's...
I certainly know how I would respond to this question, but could you imagine practicing without using balloons?
Oh no, I mean, it was something that when it was introduced to me, I thought looked, of course, crazy. I mean, it's a tough sell initially. Without the neurology, I think it's a little bit even tougher because people look at you like, you want to put a balloon in my nose? And so you kind of have to go through the conversation as to what it's impacting for them to get it. When you come at it with a neurologic platform, I think it's, to put it in lack of better terms, a better sell in a way for them because they kind of get that you're looking to do a bit more with it, not just blow up their face because you want their sinuses to work better, that There's actually something a lot bigger you're trying to do. And because you're doing it in a closer series, the protocol that you had established, it's a little bit more gentle for them to, they don't know this, but it is more gentle for them to go through that type of approach of maybe 1 to 2 inflations a day, let it settle, go from there. So I appreciated that experience that you worked into the program. Because, yeah, as I said, knowing that it was something I didn't want to practice without is why I looked at, even with the experience I had coming to this, to go, there's more to this. I want to do more with this, and this has been a good piece for that.
Yeah, I love the way that you describe that because you're reminding me of the old days when I first started using endonasal, and I came back from a similar training that I did with Dean Howell out in Tenasket, Washington, which he developed neurocranial restructuring, which is more of a structural type of program, and it was very difficult for me to come back and really figure this out, integrate this into my chiropractic practice because it was taught to me in a way that it was like you either did that or you did nothing.
Yes.
And so it took me some time to get it to integrate into a structural chiropractic practice. But then when I started to transition away from the structural chiropractic and more into the function of the brain and the neurology and the application of the endonasal work, everything improved. Like the patient response, the patient's acceptance of, case acceptance, which is really important.
Well, I appreciated that you gave that space back to me with, looking at it from my optic and with my skill set or thought process, because it wasn't, you kind of present it as this is the protocol and this is what's working for me and this is how I've gotten there. But even just, going back through and looking at the muscle testing for it, that's something I had already been using. So it helps me to marry my current program, if you will, because I'm not going to walk out and be you, nor should I. All practitioners are going to walk out and use their skill set in a manner that they're going to deliver it. That's what makes us, it's the artistry of this work.
Right.
So often in our industry, you get, this is the protocol. If you don't do it this way, you're not going to have the benefit. Well, really, you need to use it the way that it's going to work for you. And I appreciated you creating that space and it, of saying, okay, we could see how these would intermingle, or I could see how you might go about it this way. So, I look forward to future conversations to see how it kind of pans out for my work as well.
Excellent.
Hi, this is Dr. John. Thanks for joining me. If you or a loved one suffers from difficult neurologic conditions that no one seems to have answers for, send them to functionalcraniorelease.com. You can contact me by phone or email me at askdrjl@gmail.com. And remember, if healing is possible, consider it to be within your reach. Bye for now.
functionalcraniorelease.com